Good evening and welcome wherever you are in South Africa or around the world, because I believe there are a fair amount of people who've joined via YouTube around the world into this WebEx launch. Nice to have you with us. In South Africa, the cold evening, I'm sitting in my study at the moment, which is probably the warmest part of my home. Uh, but with the weather conditions as they are, you never know what's going to happen. So if something goes wrong and there's an internet connectivity problem, I'll move into my studio part of the home. So if you suddenly see me in a different area, don't get scared. I haven't gone away. We haven't changed the entire weather that is happening this evening. But on behalf of Zoetis, a Fortune 500 global leader in animal health, with more than 65 years of experience, we welcome you to the launch of Apoquel. We're very proud to introduce you to Apoquel. It's a novel, it's an innovative, and it's a first-in-class treatment for itch in dogs. Um, Apoquel is a game changer. It will improve the quality of life of your pets and the quality of life of their owners as well. Having said that, I'm in my study. If you do hear any noises, the first one would probably be snoring. It's not me. That's my 13-year-old Staffy Jess, who's lying on the other side of the desk. And if you hear any barking, that's the other Staffy, which is Blade. And he does get a bit tense at times. Also itches. So I'm really happy to know that we've got a new product around. We've got one of the leading dermatology experts in the world to share his experiences and expertise on Apoquel, Prof. Andy Hillier. But before I introduce you to Prof. Hillier, I'd like to introduce the Senior Vice President of Zoetis Benelux, Africa, and Middle East Cluster, the international operations in those areas, Mr. Dres Bergman. Dres is chatting to us from Amsterdam in Holland.
Welcome to Let's Start From Scratch, the launch of Apoquel in South Africa. Today is an exciting day because Apoquel is a real strong innovation from Zoetis, which has proven to be effective already in many countries around the world. For those of us who are dog owners, we know the frustration of pruritus in dogs. Veterinarians, many of you, know that as well. Therefore, I'm so pleased that Zoetis brought this new product to the market and now also to South Africa. This is really changing the paradigm of itchy problems in dogs. But at the same time, it's important to really know when to use the product and how to use the product. And therefore, I'm pleased that the team has organized 2 sessions to give you all the background and the details about the product. Today, with Professor Andrew Hillier, our Zoetis medical lead dermatology, an OBP graduate. How nice. And next week, another session with Professor Andrew Lysowicz from South Africa, another derm specialist, but then from your own country, based in South Africa. Really look forward to have 2 good sessions so that we can give you all the background on this exciting innovation. And I look forward to hear the developments in the coming months and to see that myself one day during my next trip when I can hopefully come over to South Africa again. I want to also emphasize that Apoquel is part of a chain of innovations that South Africa is bringing to the companion animal space. Many of you are already familiar with Simparica in the antiparasitic space, Apoquel now in dermatology, and I can assure you in the next few years more exciting products to come. I wish you a good online event and look forward to seeing you one day in future. All the best.
Thank you very much. In Holland, we now go across the Atlantic to the US. It gives me the pleasure to introduce Professor Andy Hillier. some of you may know him who are in the studying in the late 70s, early 80s. He's the medical lead for dermatology at Federal Headquarters in New Jersey, in the US. Graduated from University in 1992, practicing in South Africa and Australia. He completed a residency in veterinary dermatology at the University of Florida. And he spent 17 years at Ohio State University becoming a chief professor and head of the dermatology service. But he didn't open at all with anything to do with timing. And I'm just looking at my mobile now. This is something that came through in this link that we where Andy said, "Is the link different for this evening?" And Madeleine, the lady who's the organizer, said, "Same link." And he said, "I'm on, but I see nobody else. Can you send the link again?" At which stage I said to Andy, "It only starts at 8. This was at just before 7 o'clock this evening. So I don't know if you guys who went to Ondersupport used to get to work an hour earlier, or if it's just because he doesn't understand timing in South Africa anymore. We'll find out if he knows any Afrikaans later when it comes to questions. While he's busy presenting to you, we do invite your questions. What you can do is you can go to the question tab to the right of this page and submit your questions. And for those of you on YouTube, you can put your questions in the comments section, and we'll get on to the Q&A section after we have had the presentation. He's the Director of Dermatology, Medical Strategy and Field Specialists at Zartus. Please join me in welcoming Professor Andy Hillier.
Thank you so much. It's really my honor and my privilege to be with you today. I really want to start by recognizing the unusual times that we're living in, and I hope that you and yours are safe and that you're finding your way to work yourself through these unique and challenging circumstances. But today is a really special day in South Africa with the launch of Apoquel, and it takes me back to when we launched Apoquel here in the United States 6 years ago. And one of the first and most remarkable things is that we immediately heard about the Apoquel experience. And for owners, that was a dog that had for many months and many years been struggling with allergic dermatitis. Over a course of just a few days, these dogs were getting incredible relief and a massive improvement in their quality of life. And that was just overwhelming for owners who'd been struggling for so long. And for veterinarians, the Apoquel experience was to hear that heartfelt thanks from an owner that finally their dog had relief and their dog was comfortable and they had peace of mind. That gave those veterinarians tremendous sense of satisfaction that they could make such a difference. I want to start by looking at this cross-sectional graphic through the skin of a dog that has allergic dermatitis to briefly review the pathogenesis of atopic dermatitis. So until fairly recently, we believed that it was allergen cross-linking IgE molecules on mast cells that led to activation of those mast cells and the release of histamine and a variety of inflammatory mediators, that process is what drove allergic inflammation in dogs. Whilst that is true, and it does take place, you can see here that mast cells are really just a small part of the process. And so if we just target IgE and histamine, we're missing the vast majority of what's happening in the allergic dermatitis. And frankly, that's why antihistamines just flat out don't work in reducing itch and inflammation in dogs with allergic dermatitis. We now know that in fact it's cytokines that play the key role that drive the inflammatory response associated with allergy. So right from the beginning, when an allergen penetrates through that dysfunctional epidermal barrier and is engulfed by a Langerhans cell, cytokines are produced. And that Langerhans cell presents the allergen to naive T cells, activating them. The consequence of that? Cytokines are produced. When all of those inflammatory cells, the mast cells, the basophils, the T cells, the eosinophils, infiltrate into the allergic dermal skin, what's produced in abundance? It's cytokines. And then finally, when there's re-exposure of allergen, when the dog scratches, when there's a secondary infection on the surface of the skin, what happens? It leads to a production of excessive amounts of cytokines. But let's be quite clear. It's not just any cytokines. In the allergic individual, be it human or canine, when the Langerhans cell presents allergen to T cells, it's the T helper type 2 cells that are activated. And those cells produce a very specific array of cytokines. For example, interleukins 2, 4, 5, 6, and 13, which are really important in driving the inflammation. They also produce an abundance of interleukin 31, which we've since discovered is a key mediator of the itch that is so characteristic of allergic dermatitis. So these cytokines are quite variable. Their target cells are different. The outcomes of activation of their target cells are different. For example, interleukin 2 primarily activates naive T cells, so it amplifies those activated T cells. In contrast, interleukin 4 targets B cells, and it drives IgE production by B cells. So different cell targets, different outcomes. However, what's unbelievably cool about all of these cytokines that are involved in allergic dermatitis, they activate their target cells through the Janus kinase signaling pathway. So different cytokine, different target cell, different outcome, but it's all as a result of activation of exactly the same pathway. Let's see what the Janus kinase signaling pathway looks like in this animated cartoon. We've got a cross-section through a cell here. This could be a B cell. You see the outer cell membrane, you see the cytoplasm, you see the nuclear membrane, and you see the nuclear material, the DNA inside the nucleus. On the surface of the cell membrane, you can see this dimeric, meaning there are two parts to it, a dimeric cytokine receptor. And if this was a B cell, this might be an interleukin 4 receptor. And there's a cytokine on the outside. Notice on the intracellular portion of that receptor, on each arm, there is the Janus kinase enzymes. So let's see exactly what happens when interleukin 4 binds to its receptor. It'll bind to one side initially, but that leads to dimerization, the coming together of the two arms of the receptor. And as a result of that dimerization, that leads to phosphorylation and activation of the Janus kinase enzymes. That process acts like a magnet for some intracytoplasmic proteins called STAT. And the STAT molecules are attracted up to the activated JAK enzymes, and they dimerize and become activated themselves. This activated dimeric STAT then finds its way into the nucleus, and it attaches to very specific areas of the DNA, and it leads to transcription of DNA with the resultant production of messenger RNA. That messenger RNA finds its way out into the cytoplasm again, where it's translated by ribosomes into some kind of protein. In this instance where we said, hey, this is a B cell, and it's interleukin 4, which is activated through the IL-4 receptor, that intracellular JAK signaling pathway, the outcome would be increased IgE production. So, depending on what cytokine we're talking about, depending on the receptor that we're talking about, so the outcomes are all things here that you see, this list of 5 different things that are going to help drive inflammation and lead to pruritus in dogs with allergic dermatitis. How does this process lead to the stimulation of nerves and the behavior that we call itch? Well, within this milieu of cytokines in the dermis in dogs with allergic dermatitis is an abundance of interleukin 31. And interleukin 31 has receptors on cutaneous sensory nerves, and it'll bind to those receptors. And as a result of that binding, leads to activation of the Janus kinase enzymes on the intracellular portion of those receptors. Once that JAK is activated and becomes phosphorylated, you get an action potential that's generated and an impulse conduction up to the brain through the dorsal root ganglion. And the result is itch. Might be scratching, biting, chewing, licking, whatever. But the process is exactly the same despite a variable behavior and itch outcome. So welcome to Apoquel, oclicitinib maleate tablets. This is a novel Janus kinase inhibitor, and it's novel because it's the very first Janus kinase inhibitor in veterinary medicine. And still actually, 6 years later, the only Janus kinase inhibitor in veterinary medicine. You have to understand that there are 4 different types of JAK enzymes, JAKs 1, 2, and 3, and TYK2. And that Apoquel is kind of special because it's been designed to target and selectively inhibit, in particular, JAK1, and to some extent JAK3, and to have very little effect at the label dose, if any, against JAK2 and TYK2. So let's look at our animated cartoon of one of those target cells that we said maybe this is a B cell and this is interleukin 4 binding to its receptor on the B cell. How does a JAK inhibitor work? Keep in mind that JAK inhibitors are what we call small molecule pharmaceuticals, small molecule drugs, which means that they're so small that they penetrate through the cell membrane and avoid their target cells quite readily and accumulate within the cytoplasm. And so in the presence of a JAK inhibitor, they actually bind to the Janus kinase enzymes on that intracellular portion of the receptor of these cytokines. And that binding will actually prevent the activation and phosphorylation of that receptor. So there is still interleukin 4 present. It still binds to its receptor. There's still dimerization of the receptor, but there's no activation of JAK. That means that we have now neutralized that downstream signaling. And in this instance, we won't get increased IgE production. If it was a T cell and it was interleukin 2, we won't get activation of the T cell and increased cytokine production, for example. That's how JAK inhibitors work. Let's look at the JAK enzymes that are involved with these cytokines that are so important in allergic dermatitis, interleukins 2, 4, 6, 13, and 31. Notice that JAK1 is at least on one of the arms of each of those cytokines receptors in each case. Doesn't matter what the other is. If you inhibit one side, then you inhibit the entire process. So if we have a JAK1 inhibitor, as in Apoquel, we're going to inhibit the activity of all of these critical cytokines in the allergic inflammatory response. It's important to recognize that JAK enzymes play a critical role in activation of cells that we really need. For example, interleukins 12 and 23 are critical in the innate immune response. But that's driven through a JAK2 and TYK2 signaling pathway. Apoquel, being JAK1 specific, has very little effect on that pathway, and we wouldn't want it to. Similarly, erythropoietin and GM-CSF, that's granulocyte macrophage colony stimulating factor, drive erythropoiesis and myelopoiesis through a JAK2 signaling pathway. And clearly, we wouldn't want Apoquel to have any negative effect on those pathways. This is the essence of why it's important to be selective against JAK1. I know you're going to be really impressed with the antipruritic activity of Apoquel in the vast majority of your allergic dogs. But I want you to recognize that Apoquel was designed to target not only the itch associated with allergies, but also the inflammatory process. You know by now that these Th2 cells producing interleukins 2, 4, 6, 13, and 31 through the Janus kinase signaling pathway drive the inflammation and the itch that's characteristic of allergic dermatitis. Apoquel, being a Janus kinase inhibitor, inhibits not only inflammation but also the itch. And this is a critical thing to recognize. I think you're going to see this when you look at the results of our clinical studies in how quickly and effectively we reduce not only itch but also inflammation. How do we know that Apoquel has these effects on these cytokines? It comes from a paper that we published from studies that were performed in 2014. And what we do in these laboratory studies is we have cells that we know respond to different cytokines. And you can see here, there's the cytokines that are of interest, interleukins 2, 4, 6, and 31, for example. And within these cell cultures, we add the cytokines, and it activates the cell, and we can measure the activity that takes place. What we do then is also add Apoquel at various concentrations. And we see how effective we are within these cell cultures at reducing the activation of the cells by the cytokines. And that's called an IC50. It's the inhibitory concentration that leads to a 50% reduction in the activity of the cytokine. Okay, so what's that concentration of Apoquel that reduces the amount of activity of the cells in the presence of those cytokines by 50%? And we'll see that for those inflammatory and pruritic cytokines that we're talking about, it's a fairly low concentration of Apoquel that reduces their activity. You see for interleukin 31 at the bottom there, it's 12 nanograms per ml of Apoquel, compared to interleukin 4, which is 84 nanograms per ml. In contrast, when we look at the same setup and we look at erythropoietin or GM-CSF and their activity, it's a far higher concentration of Apoquel that's needed to significantly reduce the activity of those cytokines. I want you to keep this number in mind. It's around about 350 nanograms per ml of Apoquel needed to have an effect on erythropoietin and GM-CSF. And in terms of interleukin 12 and 23 that are important in innate immune function, you really need a significantly high concentration of Apoquel, over 1,000 nanograms per ml, to have any negative effect on their activity. So let's now turn our attention to the pharmacokinetics of Apoquel, obviously very important in determining how to dose the product. In this figure, we see the absolute bioavailability of Apoquel after intravenous and oral administration. And what you should note is that after oral administration, the curve is almost exactly the same as it is with intravenous. It tells you about the high bioavailability of Apoquel after oral administration. So at the label dose of 0.4 to 0.6 milligrams per kilogram, the Cmax is around about 259 nanograms per ml of Apoquel. With that number in mind, the Cmax of 250 nanograms per ml after administration of Apoquel at label doses, I want to go back to the IC50 for these specific cytokines. And you'll see here on the y-axis is the IC50 concentration of Apoquel in nanograms per ml. What we have here is the lines that represent where we have the IC50 concentration for the cytokines that are so important in the allergic dermatitis and inflammatory response associated with atopic dermatitis. And you'll see here interleukin 31 is around about 12, and on top there's interleukin 4, which remember was about 84. The IC50s for erythropoietin and GM-CSF was around about 350. And then the IC50s for those cytokines involved in the innate immune response was over 1,000. Now let's superimpose what happens in the plasma concentration of Apoquel when it's dosed at the high end of the dose, 0.6 milligrams per kilogram, twice a day. And by the way, look at the bottom at the x-axis. This is over a 24-hour period. Now let's have a look and superimpose when we dose Apoquel once a day. So we can put both together. And the important thing to recognize here is that the highest concentration of Apoquel has significant effect and covers the IC50 for the cytokines that are important to us in allergic dermatitis, but doesn't get to have any effect on the JAK-dependent cytokines that are not important to us, that we want to leave alone. From our pharmacokinetic study, we also discovered that you can administer Apoquel either on an empty stomach, with an entire meal, with a small treat. It has no effect on oral bioavailability, which is terrific news. So going back again, we dose in the dog at label dose of 0.4 to 0.6 milligrams per kilogram. The half-life of Apoquel is just over 4 hours. The importance for you from a clinical perspective is to understand that a drug is eliminated around about after 5 half-lives. So that means that Apoquel is basically out of a dog's system after a single administration after about 20 to 21 hours. This is going to help you understand why at no time would we ever anticipate administering Apoquel every second day or twice a week. Basically, it's been eliminated within 24 hours. The second important thing from our pharmacokinetic studies here was when did we reach the maximum concentration? It was really quickly. In fact, it was within less than an hour after oral administration. Why is that so important? When this drug was being designed, part of the profile was that it had to have rapid effect. And in fact, we had to start to reduce pruritus as quickly as what was the benchmark at that time, which was steroids. I think everybody's used steroids enough to know that when we administer steroids, we start to get relief from pruritus fairly quickly. And we wanted to be sure that Apoquel would perform as well, if not better than steroids, in terms of the speed of onset for relief of pruritus. So in fact, having studied interleukin-31 very carefully and recognizing that it was the key mediator that drove pruritus in dogs with allergic dermatitis, we cloned and sequenced it and produced recombinant interleukin-31, that's artificial interleukin-31, if you want to put it that way, that is identical to the spontaneous and naturally produced interleukin-31 by the body. And it's really helpful to have that because we now have a model where we can inject this recombinant interleukin-31 into dogs. And the only thing that happens to those dogs when you inject it is that they become pruritic. You can inject it intravenously, intramuscularly, actually intraperitoneally. And for a period of about 4 hours, the dogs demonstrate pruritic behavior. Why is that so important and what's the use to us? Well, we can assess the antipruritic activity of potential therapeutic agents by administering those agents and then injecting the dogs with interleukin-31 and see if we can suppress the pruritic activity that we know is normally induced following an injection of interleukin-31. And that's exactly what we did with this interleukin-31 induced pruritus model. We compared how quickly and how well does Apoquel suppress that pruritus compared to 2 different doses of orally administered prednisolone. And what we do is we administer the product into one group. There are 4 groups here. There's a placebo group, there's an Apoquel group, and 2 different doses of pred. All of those dogs get administered their individual product. 20 minutes later, we inject interleukin-31. And for a period of 2 hours, we monitor the number of minutes that dogs have pruritus. Here's what happened. So the placebo-treated dogs you see in gray, round about 60 minutes of pruritus over that 2-hour period. For the dogs that were treated with pred here in the kind of pink color, that were treated with pred at 0.25 milligrams per kilogram, absolutely no difference to placebo. It has no effect. For the dogs that were treated with pred at 0.5 milligrams per kilogram, less pruritus but not significantly different to placebo-treated dogs. So this is that 2-hour window within the first 4 hours after administration of the product. But look what happens in the teal here with Apoquel. There's a significant difference and definitely a decrease in the amount of pruritus compared to not only placebo, but compared to both doses of prednisolone. So I think we demonstrate here that we work as quickly and in this model more rapidly than oral corticosteroids do. And I know there's some of you out there and say, yeah, that's exactly why what I do is I administer an injectable steroid for that rapid effect. So we did exactly the same study, a placebo group, an Apoquel group, and a group that received dexamethasone. And they got 0.2 milligrams per kilogram intramuscularly. And here's what happened in that 2-hour window. What was the level of pruritus? Well, again, the placebo group, around about 80 minutes out of the 120 that they were pruritic. The dexamethasone group was less than the placebo group, significantly less, but still almost 60 minutes, and significantly more than what happened in the dogs that received Apoquel. So again, even if you want to administer injectable corticosteroids, thinking that they're going to have more rapid effect than anything else, Apoquel orally administered outperformed steroids, both oral steroids and injectable steroids. So what is the profile of Apoquel? Well, it's novel. We've already said it's the first and only Janus kinase inhibitor in veterinary medicine. It's targeted, and we make that point because as against what is ultimately your other alternative is steroids, which have broad anti-inflammatory effects, and in fact affect every cell in the body in some way. And why do we want to target anything but the skin in allergic dermatitis? But Apoquel is a novel, targeted, orally administered selective Janus kinase inhibitor. There are two label indications. The first is for the control of pruritus associated with allergic dermatitis in dogs at least 12 months of age. And the second is for the control of atopic dermatitis in dogs at least 12 months of age. And I think it's really important to recognize those two things. The first one really tells you about that dog that comes in, you say, I know this dog's got some allergy, but right now I don't know what it is because it's too early. We haven't done a diagnostic workup, or the owner doesn't want to do a diagnostic workup. I've just got an allergic dog. You can use Apoquel in those dogs from the very first time that they present to you with their allergy or the 20th time. Hopefully by the time you get to the 20th time, you've done a diagnostic workup, but we know that doesn't always happen. So it's for any allergy, from flea allergy to food allergy to atopic dermatitis to undefined allergy to contact allergy. But secondly, we know that many of these dogs, and especially the atopic dogs, have forever disease. We've got to find a long-term solution. And that's why that second indication of control of atopic dermatitis. There's absolutely no limitation on the duration of treatment that you can administer Apoquel on the label. Its efficacy, I think we've demonstrated that it has rapid decrease of itch within 1 day. It starts within 4 hours, but a significant decrease by 24 hours, and it has long-term efficacy. The dose is 0.4 to 0.6 milligrams per kilogram, twice daily, up to 14 days, and then once daily with or without food. A couple of points I want to make here. That 0.4 to 0.6 is not a dosing range. It's just purely based on dogs' body weight and tablet size. In other words, we have no data that says dogs respond better at 0.6 than 0.4. Okay? Might be the case in some instances, but that's not a dosing range. The second thing I want to point out is twice daily up to 14 days. That's not mandated. You might want to just have 5 days worth of an anti-inflammatory and antipyretic in a dog with a hotspot. You'd do 5 days of Apoquel BID. And if you were going to use Apoquel for longer than 14 days, the question we often get is, do I have to use it BID for 14 days? I would encourage you to administer Apoquel and prescribe it BID for 14 days and then once a day if you anticipate using it for 3 weeks, 3 months, 3 years. We get maximum effect through our dose determination studies by continuous BID dosing through 14 days. At the very, very least, you'd want to do BID for 7 days because we start to get close to maximum effect after 7 days, but we continue to have further improvement up to 14 days. And in terms of safety, we'll show you the data from our clinical studies. There are really minimal side effects, and they are primarily gastrointestinal. So let's have a look at the results of the pivotal efficacy studies that gave us our label claims for allergic dermatitis and for atopic dermatitis. Before I actually show you the studies, understand that in all of these studies, the primary variable that we look at that determines efficacy is pruritus. And we measure pruritus using a validated tool. It's called the Pruritus Visual Analog Scale. And this is what it looks like. The owner is given this piece of paper with the descriptors here that describe anything from a normal dog to a dog with extremely severe itching. It describes what they would be defined as those different levels of itch. And the owner then marks on that vertical line at a point where they think their dog is. We then take a ruler, overlay it on that line to get an actual score. And the score is either 0 to 10, or it may be between 0 and 100. You'll see both being used. Essentially, basically the same thing. This is the first study where Apoquel was used in a randomized controlled study versus placebo for allergic dermatitis. There were over 200 dogs in each group. The majority of dogs were presumed to have atopic dermatitis. Many had flea allergy, as you can see. There were quite a few dogs that were presumed to have food allergy. And then some other diagnoses were in fewer numbers. Pretty much equal distribution between the two groups of dogs as well. Let's look at the results of the study. This is looking at their level of pruritus from day 0 through day 7. And a PVAS was performed daily through those 7 days. On the y-axis on the left-hand side, you see the score 0 to 100, and on the right-hand side, you see the descriptor describing the level of pruritus the dogs experienced. Notice that there were over 200 dogs in each group here. The first thing I want to point out is on day 0, these dogs all started with a PVAS of around about 75. That's moderately severe to severe pruritus. So these were not mildly affected dogs. And you'll see that immediately within the first day, there's a significant difference between the two groups. And that difference widens throughout the course of the study, such that at the end, there's been a 65% decrease in the level of pruritus in dogs treated with Apoquel, and a 27% decrease in the level of pruritus in dogs treated with placebo. So that's an awesome response after 7 days for dogs treated with Apoquel. But I think there's an important point here as well. You should be extremely cautious of any study looking at changes in pruritus levels if it's not placebo-controlled, randomized, and blinded. Because look at that placebo effect. There's no question here whatsoever about the effect of Apoquel in terms of its ability to reduce pruritus quickly and effectively over 7 days. Here's just looking at it slightly differently, and we're looking at here what percentage of dogs in this study had at least a 50% decrease in their PVAS, and we'll look specifically at day 7. So 70% of the Apoquel treated dogs had a significant reduction, more than 50% reduction in their level of pruritus, whereas around about 23% of dogs who were treated with placebo had a 50% reduction. Just a different way of looking and expressing what was happening in terms of improvement in pruritus and itch relief. I think this is the most important study that we performed. And it was looking at Apoquel in one group and prednisolone in another group of dogs with allergic dermatitis. Because I think we all appreciate and understand that steroids are reasonably to quite effective at controlling itch and inflammation in dogs with allergic dermatitis. Okay? I don't think anybody argues with that. Not in every dog, for sure. But we've relied on steroids for decades, and they've done a pretty good job in some regards in terms of efficacy for allergic dermatitis. Of course, in terms of safety, it's a very different story. So again, looking at the results of this study, what we have here is looking at PVAS. It's 0 to 100, and on the right-hand side, of course, the normal to extremely severe. This was a 28-day study. The dogs treated with prednisolone received 0.5 to 1 milligram per kilogram of pred daily for 6 days, and then every other day. The dogs treated with Apoquel received the labeled dose. That was BID for 14 days, then SID through until day 28. The first time that a PVAS was performed after time 0 was actually 4 hours after administration of either pred or Apoquel. And this is the study that allows us to say that we are starting to have effect within 4 hours. And then the next time point was at 24 hours after the commencement of the treatment. And that's when significant effect was appreciated. So in this clinical study, you can see that at the end of the day, you look across and you say, Apoquel performs as well as prednisolone at a pretty reasonable dose of 0.5 to 1 mg per kg over the course of not only 28 days, but also in terms of rapid decrease in pruritus in these dogs with allergic dermatitis. To support Apoquel's anti-inflammatory effects in this same head-to-head study with prednisolone, the investigators did an allergic dermatitis visual analog scale, very similar to the pruritus visual analog scale that was performed by the owners. So on a scale of 0 to 100, and then on the right-hand side you see here a normal dog to extremely severe dermatitis. And what we see here is that over the course of the 28 days, the performance of Apoquel in its ability to reduce the dermatitis score was the equivalent of, and at times even better, than what was happening in the prednisolone treated groups. So not only is Apoquel a highly effective antipruritic, but it's also a highly effective and targeted anti-inflammatory that significantly reduces the skin lesions associated with allergic dermatitis. Now let's look at the pivotal efficacy study where Apoquel is used to manage dogs with atopic dermatitis. In this study, there are around about 150 dogs in each group, the Apoquel group and the placebo group. The dogs were monitored over 112 days, just short of 4 months. And here we're going to look at the results of the PVAS, the pruritus, over that period of time. I want you to notice that the actual placebo-controlled portion of the study only lasted for 14 to 28 days. And that's because you couldn't possibly expect a dog that was being treated with placebo and probably not improving at all to continue for almost 4 months through the course of the study. Notice also that in both groups, they start with moderately severe to severe pruritus. And it's obvious here that there's a significant difference very quickly between the placebo-treated dogs and the Apoquel-treated dogs. And we reduce the level of pruritus in the Apoquel-treated dogs from that moderately severe to severe at the initiation of treatment down to very mild levels of pruritus at day 14 when the dosing protocol changes from BID to SID. There is a small increase in the level of pruritus to mild, but then notice after day 28 how the pruritus slowly but surely starts to come down towards very mild again. I want to make sure that we talk about the small increase in pruritus that can occur when you are administering Apoquel for longer than 14 days and when you go from the BID dosing to SID dosing protocol. What we know is the majority of dogs continue to have the same level of improvement in their pruritus on SID dosing as they had on BID dosing. There are some dogs where there is an increase in pruritus. It's a minority of dogs, and in the vast majority of those, it gets nowhere near the level of pruritus that was present prior to the administration of Apoquel. There are extremely few, a small handful, where the increase in pruritus when we go to SID dosing actually does take them back up towards what was the level of pruritus prior to administration of BID Apoquel. In those instances, those small number of cases, then Apoquel is probably not the product and the drug to be used in those dogs. I think a lot of people, when they see a small increase on day 15, having gone to SID dosing, they get a lot of anxiety about it because their dog has been doing so remarkably well on BID dosing that any change, any increase, even a small increase, is quite distressing to them. And they kind of have an exaggerated reaction and response to it. And I'm going to show you why I think that might be the case when we look at what happens to the dermatitis scores as well. As I said, the placebo-controlled portion of the study was really the first 14 days. After day 14, and between day 14 and 28, the owners of the dogs in either group, and they were blinded, they didn't know what they were given, they could decide to discontinue administration of the product they were given if they weren't happy with the results. And what we saw was that 86% of the dogs being treated with placebo discontinued. Naturally, they weren't getting any better. And there was about 15% of the dogs being treated with Apoquel who discontinued. I think that speaks volumes to the fact that 85% of Apoquel treated dogs actually continued through all the way in the study through day 112. That speaks to the efficacy of Apoquel both initially and long term. Here we're looking at the scores, the allergic dermatitis scores. We used a CADESI-2 scoring system. I want you to notice that naturally the dogs being treated with placebo in the gray here did not improve because their level of pruritus was only marginally decreased. When we look at the dogs being treated with Apoquel, significant decrease in the CADESI score on day 14 compared to day 0. And notice here that when they went to SID dosing between day 14 and day 28, there was no increase in the CADESI scores. And that's in contrast to the owner's pruritus visual analog scale, where there was that small increase. And the fact is, if there truly had been an increase in pruritus between day 14 and day 28 because we went down to SID, and if that increase had been significant, you would naturally have anticipated that the CADESI scores in the skin lesions would have got a little worse as well. And that doesn't seem to have happened. If it does, it's going to be in a small minority of patients. Over time, of course, as we continue to administer an anti-inflammatory with the specificity and targeting of Apoquel, we continue to get improvement in their CADESI scores and in the appearance of the skin. Now that we've established the efficacy of Apoquel in dogs with allergic dermatitis and atopic dermatitis, of course, every decision we make is a risk-benefit ratio. The risk is related to what's the safety of the product. Out of all the safety studies that we performed, I want to present to you 3 studies that I think exemplify the safety profile of Apoquel. The first study is our margin of safety study. Here we had 4 groups of dogs consisting of 8 laboratory beagle animals. One group received placebo, one group received the label dose of Apoquel, a third received 3 times the dose, and the final group received 5 times the label dose of Apoquel. Not only that, but all of these dogs were dosed BID for 6 weeks initially. That's 3 times as long as the label indication of up to 14 days. And then once a day dosing was continued for an additional 20 weeks. So this study continued for a full 6 months. And the findings of this study across all groups were that there were some effects. But essentially the effects that were seen in the dogs treated with the higher doses than we have on the label were what you would expect pharmacologically knowing the activity of Janus kinase enzymes. None of these dogs died, none of these dogs had serious side effects, and most of the effects that were seen were mild and non-progressive. The FDA looked at the results of the study and said we had established a margin of safety with the label dose of 0.4 to 0.6 milligrams per kilogram, BID for up to 14 days, then once a day. Secondly, let's look at adverse effects that were reported during our pivotal efficacy studies. This is during the allergic dermatitis study. Those first 7 days, what happened in placebo dogs versus Apoquel treated dogs. And you'll see that very few side effects were reported by the owners. Essentially, kind of 1 to 2% of dogs had GI side effects in terms of diarrhea and vomiting in the placebo-treated dogs, and around about 2% of the dogs in the Apoquel-treated dogs. No significant difference between the 2 groups. Then if we look at our atopic dermatitis efficacy study, where we look at side effects that were reported in dogs treated with placebo over the first 16 days versus Apoquel over the first 16 days, we see very similar results. In this instance, once again, GI side effects like diarrhea and vomiting rose to the top, but in the placebo-treated dogs, it was only 3 or 4%. And honestly, you look at the Apoquel-treated dogs, again, 3 or 4%. So that speaks to the safety of Apoquel when it's administered compared to placebo. Always the most important thing for us to consider, what happened in a parallel group of dogs at the same time. And then we were extremely fortunate with Apoquel to have what we call our long-term compassionate use study, sometimes referred to as the continuation therapy study. Let me just back up a second and tell you how unique the study was. So what happened through all of the development and dose determination studies with Apoquel over the years is dogs would be treated with Apoquel and would do very well. And they'd get to the end of the study and would exit the study and they'd go back to the really troublesome and kind of disastrous and train wreck situations that they were prior to administration of Apoquel. And there was a significant number of owners and investigators who petitioned not only Pfizer, as we were then, but also the FDA to allow compassionate use continuation therapy with Apoquel after dogs had completed true studies. This is the first and only time in veterinary medicine that there has been a compassionate use study. So we were very fortunate to be able, at the time of launch, and actually on the label as well, to have the results of this continued use over a longer period of time to understand the continued efficacy and continued safety of Apoquel. And in this study, there were 247 dogs. The mean duration of treatment was over a year, being 401 days. Some of them treated out to almost 2 years. And in fact, in the figure that you see on the next slide, you'll see that some dogs were treated actually over 1,000 days. Bottom line, you can read the results of the study in a publication in Veterinary Dermatology in 2015. But the conclusion was that Apoquel is safe and efficacious when it's used long term. So let's have a look what happened in terms of pruritus with these dogs over the course of the study. We have the pruritus visual analog scale, 0 to 100 on the left y-axis. You see the description here on the right y-axis. Notice the day of the study I mentioned, there were some dogs that went beyond the 600 odd days that were reported in the manuscript. Some here are to over 1,000 days in the study. And you'll notice then here on the x-axis that the dogs were seen every 90 days. That was a prerequisite for inclusion into the study. So they were evaluated by the investigator, the majority of whom were dermatologists, CBCs, chem panels, UAs, any additional testing that was indicated, and obviously a full physical examination were performed. So let's see what happened to their pruritus. Again, looking at day 0, these dogs start with this moderately severe to severe pruritus. Then we look at their evaluation every 90 days and we see that they continue to maintain excellent control of their pruritus in that very mild to mild range. And I think that the lesson from this is that dogs that respond initially to Apoquel, the vast majority of them will continue to respond to Apoquel long term. And in fact, in this study, only 7% of dogs out of the 247, only 18 of them, 7%, withdrew due to any worsening of clinical signs. Now I'm going to tell you that as you get more experience and exposure to Apoquel and have more dogs on it, you are going to have owners call you after 3 months or a year and say, look, it was fantastic initially, but it's just not working anymore. I don't want to use it. What else have you got? What you have to be extremely careful of is that the vast majority of those dogs where there is apparent loss of efficacy, those are dogs that now have a secondary infection. When you get control of the infection, you're going to find Apoquel is working just great again. Or the owners stopped using parasite control because everything was so great. Why do they want to do that? Well, now the dog's inundated with fleas, and once you get parasite control back again, you'll find the Apoquel is far more effective. Or the dog was on a special diet and they stopped that. They changed to a different diet. Get them back onto the original diet and suddenly the Apoquel is effective again. Well, it's just that time of year. You know, the dog's really bad in the spring or the summer, and it just needs a little extra help at the most challenging environmental allergen time for that particular patient. Point is, don't give up. It's a very small handful, 7% in this study, that actually have a true loss of efficacy. What were the abnormal health events that occurred? Well, they were similar to what we saw in other studies, mostly GI disturbances. When you read through the report, you'll see there were some serious adverse events. Some of the dogs did die. Some of the dogs developed neoplasia. But really, when you look at the number of dogs and the duration that they were monitored, there's nothing there that would suggest that it's any different to a group of dogs in the general population that you might monitor over the same period of time. So let's review the important safety information for Apoquel. Firstly, it should not be used in dogs less than 12 months of age or in dogs with serious infections. Many will say, what's a serious infection? For us, the FDA refuses to define that. We in the US have always regarded a serious infection as something like a bacterial pneumonia or a bacterial endocarditis or discospondylitis or a significant systemic fungal infection or something like that, okay? Staph pyoderma, malassezia dermatitis, whilst important and contributing to the dog's disease and need to be taken care of, are not serious infections and should not be regarded as reasons that you cannot administer Apoquel to a dog. Apoquel may increase the susceptibility to infection and demodicosis and may exacerbate neoplastic conditions. This is a statement that was put on the original label because of the drug class that Apoquel was put into. Not because of known effects of label doses of Apoquel, but just because of the drug class. I'm going to address some of this in future slides. Apoquel has not been evaluated when administered in conjunction with other immunosuppressive agents like steroids and cyclosporin. In fact, there is a study, it was published by Panteri in Veterinary Dermatology several years ago, where dogs received 3 weeks worth of Apoquel and 3 weeks worth of cyclosporin concomitantly, and there were absolutely no adverse effects associated with the co-administration of those two products. And Apoquel should not be used in breeding dogs or pregnant or lactating dogs because it hasn't been studied in those. We're very fortunate in the US. We've had Apoquel for over 6 years. Over 8 million dogs have been treated and found relief from their allergic dermatitis. Pretty awesome number. Last year, after 5 years, we decided to do a really comprehensive, robust evaluation of all of the pharmacovigilance data that had been reported in and then delivered that to the FDA. And here's what we found. When we add up all of the adverse events and knowing how many dogs have been treated, the total cumulative number of adverse event reports, really the incidence is rare. What that is defined as by the European Medicine Agency is between 1 and 10 dogs every 10,000 treated might have any type of adverse events. That's rare. For individual adverse events, they were very rare. In other words, less than 1 dog per 10,000 treated is likely to have the occurrence of any single individual adverse events. And the most commonly reported ones were vomiting, diarrhea, lethargy, anorexia, and a variety of different blood work changes. This is remarkable and actually tells us that Apoquel is performing in the field, under field circumstances, in dogs with naturally occurring disease, just exactly as we anticipated. Here we are 6 years later. No new warning signal, no new red flags. So this validates the really strong safety profile of Apoquel. I want to specifically address the issue of Apoquel and neoplasia, because I think when you first get hold of Apoquel and you first read some of the reports and what you might have heard already, you may have some concerns about the administration of Apoquel and the potential for the development of neoplastic disease. When we look at our long-term continuation therapy study, those 247 dogs that were monitored for an average of 407 days over a year, 16 of those dogs developed neoplasias. That's around about 6%. The average age of those dogs was 9.3 years. And what we believe is that that is exactly what you might anticipate in any group of even healthy 9 to 10-year-old dogs that you monitor for a period of in excess of a year, that you would anticipate that at least 6% of them would develop a neoplastic disease. So the incidence of neoplasia in our long-term compassionate use study was similar to what you might expect in a normal population of dogs. In our pharmacovigilance review from 5 years worth of data, the 2 most commonly reported neoplastic conditions were papillomas and histiocytomas. Both of those are really very benign, self-limiting, and they spontaneously resolve in the vast majority of cases. That's not to ignore them. However, they were reported very rarely. That means less than 1 dog out of 10,000 treated has been reported to develop papillomas or histiocytomas. And any other cancer that you want to think about would be less than that. Finally, last year, there was the presentation of a really interesting abstract at the North American Veterinary Dermatology Forum by Brittany Lancelotti, and our dermatologist. And what they did is they had over 300 dogs in an Apoquel treated group. This was dogs that had been treated for a minimum of 6 months with Apoquel for their allergic dermatitis and had been monitored for at least 2 years. And they compared that group of dogs with a group of dogs with allergic dermatitis that had never seen or been treated with Apoquel, that had been monitored for at least 6 months, or had been treated for at least 6 months and monitored for a minimum of 2 years. They were age and breed matched, over 300 in each group. And their findings was that there were no significant differences at all between the groups in terms of the incidence of malignancies and dermal skin masses. That's further validation of the statement that we make, which is that there is absolutely no evidence that supports the fact that the administration of Apoquel is associated with an increased incidence or higher risk for the development of neoplastic disease. So now you have Apoquel to help you manage your allergic patients in the short term, the medium term, and the long term. But it's not just another anti-inflammatory, another antipyretic to kind of get you off the hook. There's far more to it than that.
We are taught to believe that we take care of pets. We feed them, we walk them. They live with us in our homes. But at Zoetis Pet Care, we believe that pets take care of us. They understand when you're down, when you're hurt or afraid. They can make us laugh, make us cry, make us calm. They smile when we need it most. They can be your best friend, your protector, your guide. They know when we're not around. They are there for us when we need them most. And that's why we believe that pets are so incredibly important. Why we think they are crucial to humanity, to society, to the future. And why we've devoted our science to developing cutting-edge treatments, helping veterinarians, innovating medicine, and putting animals at the center of everything we do. Because at Zoetis Pet Care, we take care of pets, like pets take care of you.
So as we provocatively suggested in the title for this presentation, Apoquel's a game changer. It's not just another itch product. Why is that the case? As the video showed and implied, kind of gone are the days for many people who have pet dogs where they were purely there for protection. Sure, that's the case in some instances. But we know now that they've become far more part of the family. That human-animal bond has become stronger and stronger over the years. They live with us indoors. They sit on the couch and watch television with us. They sleep in our beds. They go on vacation with us. It's really important that we recognize that bond. What I think we've struggled to recognize as veterinarians treating dogs with allergic dermatitis is that the owners of these dogs are on an emotional roller coaster. That's clear to see in the train wreck that comes in that's been going on for 3 or 4 years. Clearly those people are. But even in the dog and the owner, who's you seen for the very first time, where the owner's telling you that their dog's been itching for 3 or 4 weeks and it's just getting on top of them now, please do something, doc. Those owners are on an emotional roller coaster. And how do we know that? Well, we did some research and we found that 9 out of 10 owners who present in their dogs to the veterinarian for the first time for allergic dermatitis have already tried at least 1 and sometimes as many as 15 over-the-counter medications. And they're not there with you because those over-the-counter products are working. They've failed. So think about that. They've gone to the trouble of getting something at the pet store from the groomer. They've paid for it. They've tried it, gone to some effort, and it hasn't worked. So they're frustrated, they're disappointed, they may be angry that they've spent money that didn't do anything. They have emotions. They're on an emotional roller coaster. And I think we need to recognize that, because when we see that pet for the first time, the opportunity for us is enormous. Are you going to delight that owner or are you going to disappoint them? Okay? If you administer antihistamines, which are essentially ineffective in allergic dermatitis, you're going to disappoint them. If you administer steroids, you might replace one problem, like itch, but you're going to replace it with a variety of other problems: polydipsia, polyuria, polyphagia, weight gain, behavior change. We know that over 50% of dogs treated short-term with steroids have at least one or more of those adverse effects. And even for those that don't, you've had to have that awkward conversation with the owner and kind of warn them that those things may happen. So that owner, even if they don't experience the side effects in their dog, they're concerned that they may occur. So you're not getting them off the emotional roller coaster. What we want to do is stop the itch as soon as possible, get that dog back to normal, give the owner peace of mind. That's delighting them. That's an awesome experience. And why is that important? Well, if we provide itch relief without adding to the burden of care with side effects of steroids, we give that owner a great experience. And if they have a great experience, then they have some trust and confidence in the veterinarian. And trust and confidence leads to loyalty, and it leads to them accepting the offer for best medicine in terms of diagnostics or therapeutics. That's what we all want. We all want to practice best medicine. For that to happen, the owner has to believe in us. And this is a great way for helping them to believe in us and finding a long-term solution and pursuing that diagnostic that we know is so important in dogs with allergic dermatitis. So we've got to show them the value. And there were two great studies and reports, and I'll just pick out a couple of things that came out of them. When discussing costs, which we all get to that, owners are more interested in the outcome and what you're going to do and what your suggestion is and the effect it's going to have on their pet's health and the value of the treatment. And in fact, 8 out of 10 owners would probably say yes to a recommendation if the value of the test or the value of the treatment were explained. That's really important to understand. So what do I mean by value and how do we communicate that? I think we very easily think of value as cost, and you might say something like, I'm giving Charlie Apoquel for the itch, it'll cost you 200 Rand for X number of days or 300 Rand, whatever it might be. Okay, and what do you think about that? Are you okay with that? The only thing that the owner heard was a Rand amount. There's no value statement there, okay? What we should preferably be saying, I understand how concerned you are about Charlie's itch. Apoquel will get him feeling comfortable within a day and without you having to worry about the side effects of steroids. What that is a value statement on multiple levels. Firstly, you've shown some empathy. You get it. And the owner's going to say, gosh, I really like that veterinarian. Really understood what was happening in my dog and how it was affecting me. Okay, that I was concerned about it. Secondly, what I heard was my dog's going to be comfortable within a day. Heck, that's exactly what I want. And I'm not going to have to worry about steroids, which I know are not good for my dog. Gosh, yes. 8 out of 10 people are much less concerned about the Rand amount, their cost, once they've recognized that value statement. Of course, for some people, there's going to be a limitation. But for the majority, make sure you let them know what administration of Apoquel is going to mean to their pet and to them. So this has allowed us to change our approach to the pruritic dog. In the past, what we said was the most important thing and your priority was to pursue a diagnostic workup, to find and make a specific diagnosis so that you could institute specific treatments, and that gave you the best probability and chance of finding a long-term solution. I'm still all about the diagnostic workup. It's still critical. But actually my initial priority has changed. I like to look an owner in the eye and say to them, I totally understand how your dog's itch is affecting not only your dog, but it's affecting you and your family. And my priority today and throughout is to get your dog feeling comfortable, to reduce the itch, get life back to normal. That puts the owner at ease, okay? That gives them peace of mind. So when I follow up and say, this is the 3rd or 4th time that you've been in, and we really want to understand why your dog continues to get a recurrence of this irritation so that we can find a better long-term solution. we want to do a diagnostic workup. And that includes ruling out parasites, treating any infections. We might need to do a food trial. How do you feel about that? That doesn't sound so daunting and so awful when they know that throughout that process, whether it takes a few weeks or a few months, their dog's going to be comfortable. And I truly believe that far more people will buy into the offer of a diagnostic workup if they know that their dog can be comfortable, because we can administer Apoquel intermittently as necessary throughout the process. And if we don't remain committed to the diagnostic workup, we miss the opportunity of maybe finding a curable disease like scabies, or disease that's readily controlled like food allergy. Change the diet and the dog's controlled. And we leave ourselves, if we don't follow that diagnostic workup, really with fire engine medicine. We go from one itch crisis to the next, from one ear infection or skin infection to the next. And there's recurrence of disease, and there's progression, and there's frustration and disappointment. And there's certainly no satisfaction, there's no loyalty, and there's no trust. That's not how we want to be as veterinarians. So now we have Apoquel, which we can use right from the get-go to get the itch under control, from the very first time. It's not to be reserved just for the severe train wreck case. Let's use it from the beginning. Let's offer best medicine the very first time that we see a dog that we suspect might have allergic dermatitis. And then throughout that diagnostic process, whether it's a 1 to 3 month flea control trial, whether it's 2 weeks worth of treatment for an infection, or 8 weeks of a food trial, let's keep the dog under control. Okay, let's make sure that the dog's comfortable. We can discontinue it very quickly and see if there's a recurrence of the pruritus. And at the end of the day, if we happen to make the diagnosis of atopic dermatitis, which is so common in our patients, then we've got Apoquel that we can use for extended periods long-term without limitation to control atopic dermatitis. And to finish off here, I want to share with you some market research that we've done to let you know how satisfied both pet owners and veterinarians are with Apoquel. Pet owners told us 90% of them said they'd recommend it to a friend. 96% said that it improved the quality of life of their pet. And 94% said it improved their quality of life. And for veterinarians, 99% would recommend it to a colleague veterinarian. 96% were happy with the efficacy. 98% were satisfied with the speed of onset of Apoquel. And 91% were satisfied with the low number of side effects that were experienced. 90% across the board. That's absolutely unprecedented and phenomenal. This tells you about the Apoquel experience. Apoquel, changing the way we manage allergic dermatitis. Thanks so much for your attention. I hope you and your clients and your allergic patients soon understand and experience Apoquel.
Okay, thank you very much, Prof. Hillier, for sharing your experiences with us on Apoquel. We move now into the Q&A section here, and some great questions been coming in on this particular site and also through YouTube as well. We'll get through as many of those as we can. We do understand that we may run a bit over time. We also understand that a lot of you may have to drop off to resume your day and to carry on with the practices. But we are joined in the Q&A section by Professor Andrew Lysowitz, Professor of Small Animal Medicine in the Department of Companion Animal Clinical Studies at Onderstepoort. Prof, welcome. The floor open for questions, and let's leave you to moderate this, because being somebody who has dogs which itch, but also cats as well, which also itch. I think it's best to leave it between the two Andys to sort this out. So here we go with the Q&A with ANA.
Thank you, Jeremy. This is Andy number 2 speaking to Andy number 1. Here's a question for you, Andy. Is Apoquel an immunosuppressive drug?
You know, I'm so glad that came in. And I want to give a shout out to the South African regulatory authorities, because they got it right. It's categorized as an immune modulator in South Africa, right? In the US, it's categorized as an immunosuppressive. And that's because 8 or 9 years ago, before anybody really understood about JAK inhibitors, it was the FDA here said, well, it affects the immune system, and everything that affects the immune system, we just put in as an immune suppressive. Bottom line is, it affects a small part of the adaptive immune response, only certain cytokines. Doesn't affect the whole adaptive immune response and has very little effect on the innate immune response. So it's not immune suppressive, it's very targeted. Secondly, I would just say why you got it right with saying it's immune modulating. Remember the studies when we talked about the IC50? We were trying to inhibit 50% of the activity of those of the activity of the cells with the cytokines, not IC100, right? And IC100 would be suppressive. What we were doing is just dampen down the effects of the cytokines involved in allergy. So it's targeted immune modulating drug and really is not an immune suppressive as we think of in autoimmune disease, etc.
Right. Here's another one. Why can you not use Apoquel in dogs that are less than 12 months of age?
Yeah, it's a really good question, and I didn't address it in the presentation, so I'm happy that people have asked. So our margin of safety studies, which is a standard study you have to do with every dog, and you administer it at 1, 3, and 5 times the dose, and I reported that in the presentation, and we did that in adult dogs, and there was nothing significant that happened. No dogs died, no major diseases, no dogs had to be withdrawn from the study. So it's safe to use in dogs 12 months of age and older. We did the same study in 6-month-old dogs. At 3 and 5 times the dose, what happened was that some of those dogs, not all of them, but some of those dogs developed demodicosis, and some of those dogs developed bacterial pneumonia. Those were regarded as significant adverse events, even though it was at 3 and 5 times the dose, not at label dose, okay? But we didn't establish a margin of safety, and that's why it says on the label, dogs need to be 12 months of age or older.
Helpful. And here's another one. What types of allergic dermatitis can Apoquel be used for?
Yeah, any, I guess. And I think that people ask that, and it's almost like, well, we always know what's wrong. Yes, you can use it in flea allergic dogs. You can use it in atopic dogs. You can use it in food allergic dogs, dogs with contact allergy, dogs with insect bite hypersensitivity. But you know, I was in general practice for 8 years, and I know that there's a very big bucket is, I don't know what allergy, but I know this is an allergic dog, okay? I've yet to work it out. Owner won't go with a workup, whatever it is. And I know you're going to talk about that next week. But the fact that you need to suspect, have a reasonable to strong index of suspicion that the dog has allergic dermatitis, okay? If you think that, then you're free to use it to control the pruritus and control the inflammation, whilst hopefully you then get an owner to buy into the diagnostic workup.
Great. Can I use it in cats?
Yeah. So we've had it, as you know, we've had it for 6 years here in the US. That is still today, every time I speak, I can guarantee if I got $1 for every time that question was asked to me, I'd be really wealthy. The answer is we have not done the studies that we can say to you, here is a safe and efficacious dose. And it's to be used in cats, okay? There's quite a lot of information. In fact, I put on the chat there that if you Google about it, I'm not at liberty to share a whole bunch of stuff here, okay? Except that the label is for dogs. You Google cats, Apoquel, you'll find, especially Google Scholar, you'll find some studies. And the one that I would suggest you look at, which is probably the most informative, is from Chiara Noli. And she compared Apoquel in one group to another group of cats treated with Medrol. And I'll leave it at that. And, that's for you to assess, recognizing that would be extra label use.
Great. And when you want to switch from steroids that have been used for a long time, and you want to now change to Apoquel, how do you do that switch? Is it like a sudden switch? Do you need to taper the steroids before you start the Apoquel? How do you make the switch from Pred to Apoquel?
Yeah, and that also is a great question because, the label says that co-administration of Apoquel and steroids hasn't been studied, and probably we should avoid that. And there are some reports of co-administration, but to answer your question, ideally, the answer would be this. You're going to taper your pred, a 2-3 week taper, something like that. We normally do, right? If you've had a medium long-term duration of pred, you want to taper it over a period of a few weeks. Okay, and once you've tapered the pred, you'd start Apoquel. That's all good and well in theory, but when you do that with your own and you say, okay, so we're going to go down from 1 mg per kg of pred every other day to a 0.5 mg per kg of pred every other day. What happens is that you get a call 2 days later saying, I did that and my dog's really itchy now. And I've got to wait 3 weeks till we get off the pred before I can start the Apoquel. So in reality, as you start tapering the pred, dogs become really itchy again. So, you know, my answer has been, I'm not worried about it for a short period of time as we taper pred. I would start the pred at the same time and continue my taper, unless there was something about that patient that made me super alert that I was concerned about the risks maybe with the 2 drugs on board at the same time. But if everything else is equal, this is just an allergic dog, I think you do it at the same time, because otherwise you run into that trouble that, you know, the dog gets real itchy before you get to add in the Apoquel.
Here's another one. What can I expect if I continue Apoquel twice daily, long term? So in other words, after the sort of initial 14 days of twice a day, I now drop it to once a day, and I don't get the kind of control that the owner is looking for. If I just carry on BID forever, is that dangerous?
Yeah. The answer is that you can expect a rap over the knuckles, okay? First of all, it's off-label. No, and so I'm going to start off by saying we did really a large number of studies to determine what we knew was going to be a highly effective dosing protocol together with a really strong safety profile, okay? Because those 2 things are both important for our patients. And so we did lots of studies. We did a study continuing BID for 84 days at the label dose. What happens is that you increase the risk for adverse events, okay? I can't tell you anything about, well, gee whiz, in that study, you know, half the dogs died. That's not the case at all. But the dosing protocol is designed to maximize efficacy, minimize side effects. And the vast majority of dogs we know do very well when you convert from the BID to the once-a-day dose. You should not continue BID long-term. Okay, that doesn't mean to say that we as veterinarians don't do things off-label. I understand that, okay? But that should never be your go-to. If a dog's not doing well enough once a day, I'm going to look for alternatives, okay? I'm not saying, well, I'm just going to go back up BID forever and not worry about it. That would be a mistake.
So, Andy, one of the questions that does come up every now and again is, what about using Apoquel concurrently with other drugs, especially things like non-steroidals for osteoarthritis, etc.?
Well, that's one of the joys, actually, because, you know, before you had Apoquel, you only had steroids, really, that were effective for allergic dermatitis. A lot of dogs have allergies, and a heck of a lot of dogs, as they get older, get OA. You know, now what do? It's really challenging. You know, you've got to give up one of them somewhere. And you can use Apoquel concurrently with any non-steroidal long-term, and there should be no problem. Bigger picture, really, Andy, is to say that there isn't a single drug on the label that it states that it's a contraindication to administer concurrently with Apoquel. It does say that it hasn't been studied long-term in use with steroids and cyclosporin and other immunosuppressives, but that's not a contraindication. So there's going to be lots of drugs that people are looking at. In our continuation therapy study, those dogs that were monitored for over 400 days, over 1,000 drugs were used. And the FDA saw that, and they never picked out any of those and said, whoops, can't use those drugs, okay? So no contraindications.
Great. So if you have this dog that's been on long-term steroids and now you want to do the switch and get it onto something that's not going to cause PUPD and polyphagia and make it look like a block of butter on 4 table legs, and you want to make that switch, do you need to do like taper the steroids, or can you switch from one day to the next, or how do you actually make the switch safely?
Yeah. So yeah, you want to make the switch. Maybe steroids are even effective at controlling the itch to some extent, but you're dealing with the side effects, and no one's happy with those. And you know what happens as soon as you start backing off the steroids, you know, and you go from a say 0.75 mg per kg to 0.5 every other day. 2 days later, you get the call from the owner, hold on, the dog's itching again now. That's no good. And if you're going to taper over 2, 3, 4 weeks, which is typically what it takes, that means you've got an owner who's looking at their dog getting more and more pruritic and getting secondary infections and all the rest. And I don't think you need to do that and be totally tapered off before you can consider administration of Apoquel. So if that's what the case is, and it's a 2 to 3 week window where they're going to be given concurrently whilst you taper the steroids, please start the Apoquel. Okay, start that BID dose up to 14 days, then once a day. I don't think there's a problem with that.
Right. And then the question arises that when you switch from a BID to an ORD use, some dogs show a little bit of an itch. So why do we ever switch to an SID dose from the BID dose?
Why don't we just continue BID? In other words? Yeah. So there were literally about 18 studies that were done, dose determination studies. It's pretty mind-blowing because we had a product profile that we wanted to meet, okay? In the design of this product, going back 10 or 12 years here, a group of people sat down, what would you ideally like to replace steroids? Because steroids have been the standard and we know we don't want them, veterinarians want something else. And there were 3 things that came up. Number 1, it has to work quickly, as quick as steroids. Number 2, it's got to be effective as steroids. And number 3, and very importantly, it has to be safe. And that's where steroids fail, right? Steroids meet the first 2 criteria, but not at all the 3rd criterion. It was incredibly important, the safety. So through all of those dose determination studies, doing all sorts of doses, BID long-term, starting SID, et cetera, you maximize efficacy and you retain really great safety by starting BID, getting the dog well controlled, then you can maintain control in the vast majority of dogs going down to SID. And we don't continue BID, not because there's nothing that we saw. We had one study that was 84 days long, BID continuously. And there was nothing terrible that happened to those dogs, but it's the potential for adverse effects. And Andy, like you and I know, there's a lot of dogs with allergic disease which need long-term treatment. It's a forever disease. We know this is going to be used not just for 84 days, but for 384 days, for 1,000 days. Safety is incredibly important. So for the potential of adverse effects, if you continue BID, when we know that SID long-term maintains the vast majority of dogs, we didn't want to take that risk.
Here's another one. Can I use Apoquel in dogs that are suffering from Cushing's or from diabetes?
Yeah, you have that on your label. It's not on our label, but it's a fair thing. So Cushing's disease is an immunosuppressed dog. It's a little bit, it's a little bit around, I guess, we haven't studied it in concurrent use with other immunosuppressive agents like cyclosporin and steroids if you've got a dog with Cushing's. My question would be, a dog with Cushing's that's pruritic, boy, I want to find out why that dog has pruritus. It might be allergy, but heck, I'm looking very carefully for the secondary pyoderma. I'm looking very carefully for the Demodex. I'm looking very carefully for something else that is causing the pruritus before I say, I'm going to throw Apoquel on board. Okay, I'm very alerted then to my diagnostic workup and other causes of pruritus. In terms of diabetes, there's no contraindication with insulin or any drug that we might use for diabetes and the co-administration of Apoquel. I think the risk-benefit ratio, which is a decision we make every time we decide to treat a patient, is a little more complex there. That's what we study 5 years for, is to be able to be good clinicians and consider the risk-benefit. So it becomes a little more complex, but I'm looking carefully in the Cushing's dog for something else causing the pruritus, and I don't see a problem in a diabetic animal particularly.
Great. There are a couple of questions just still coming through. We'll answer those in the chat, but for now we need to move on. So Jeremy, back over to you.
Thank you very much, guys. And thanks for all of the questions coming through. And we'll, as Prof. Lasowitz said, they'll continue answering those in the chat. Just to close down though, let's get a final word from the General Manager for Zoetis Southern Africa. Here's Adrian Pratt.
Good afternoon. Allow me to echo Prof. Hillier's opening comments in recognizing the unique times we're going through and hope that you and your families are healthy and safe. I'd like to thank Prof. Hillier for his presentation and for taking the time to support us for the launch of Apoquel in South Africa. It's been a long time coming, and I'm sure that it will be well worth the wait once you get to experience the product for yourselves. Congratulations to the Zoetis companion animal team for the professional manner in which you've delivered this launch event under exceptional circumstances. I'm proud of all of you and proud to be part of Zoetis. Lastly, a special thank you to all of you attending today's event. Without your support, Zoetis would not be able to bring great products like Apoquel to market. We're there to support you however we can. Please reach out to any member of the Zoetis team if you require assistance. Stay safe.
Adrian Pratt, General Manager for Zoetis Southern Africa. Thank you very much for joining us today. Thanks to the entire team at Zoetis for their ongoing commitment to research, to development, to making it possible to bring brands like Apoquel to the market. The Zoetis team will be calling on you guys over the next few weeks and months to discuss not only the product, but also to share marketing and promotional material available to you and your pet owners as well. They'll be available to answer any questions you have about Apoquel. And if you'd like a recording of this particular talk, it's going to be available on the website http://let's-start-from-scratch.co.za. Okay, I'll give it to you again. http://let's start from scratch with dashes between all of them .co.za. Thank you for your time. Really appreciate you having been with us. Take care, stay safe, and goodbye.